Hey everybody. I'll talk about Rafa's Moonshot. It's a non-profit research fund that we founded actually this week. I will tell a personal story and you will understand how it's connected and related to Yuval's and UNI Therapeutics technology and drug repurposing. So we're talking about rare diseases, the STXBP1 gene, and our mission is to land a cure. Yeah, so this is me. A bit about my career. I'm an entrepreneur. I'm cybersecurity entrepreneur. I founded 2 companies. I exited my last company to Checkpoint Security in 4 months ago. But that's not the main thing. I co-founded Rafa's Moonshot. I'm married to Ella. She's a neurologist. We're talking about neurodevelopmental disorders, so that's a karma. And the biggest exit is Rafael. This is why we call it Rafa's Moonshot. I'm a bit excited because it's a personal thing that it's the first time that I'm sharing my story, our story. The diagnosis was 1 year ago in February. It was a rainy day. And we came to the doctor's room. It was a very small room, no windows. And I remember every single detail. There was a pile of papers on the table, and the doctor said to us, we found something in Raphael's exome sequencing, in the genetic testing. And then he told us, it's the STXBP1 gene. And I'm coming from tech. I didn't know what it is. What is the meaning? There are no papers. And he started to say things like severe epilepsy, developmental delay, and many other different words that I had to remember and learn afterward. And then he said, there is no cure. What can we do? He said, come back in 1 year and we will talk. But we knew that there is a hope. We need to do something. And this was a week before we started, a week after the diagnosis, we started to work. And we will do the impossible. That's our mission. That's our moonshot. So we launched Rafa's Moonshot. In the past year, we worked on our research. We developed 4 disease models. We talked with many researchers, clinicians, scientists, and eventually in 6 months, we got into effective treatment, a compound that is working. But still, we are working hard on finding a better treatment, a better solution, not only to Rafael, but to many other kids that are diagnosed with rare genetic diseases and single gene diseases. So we founded Rafa's Moonshot, and we're going to focus on many different pillars. We have a short-term, mid-term, and long-term plan. But I want to talk maybe about the short-term, the personalized medicine and drug repurposing. How we can take the genetic sequencing and find a potential solution utilizing technology. I'm coming from technology, from tech, and we looked for the fastest solution. And this is where I talked with Yuval and UNI Therapeutics, and we love their technology, and I wanted that Yuval will tell about the connection with us and the story. Sorry.
So I think that the story is really moving, and what Sagi is doing as a father is amazing, and thank you. Okay, and this is me. I'm Professor Yuval Tabach. I'm a founder of UNI Therapeutics. And the story of rare diseases, actually you can hear a lot about it there in the other room, but don't go. So there is a huge challenge in rare disease. And the challenge is that it's take, in many cases, more than 7 years to be diagnosed. There are around 8 physicians that are involved in the process. And if you want to know about these really amazing cases, you can go to a Netflix. So it is actually a series called The Diagnostic, and they are talking about these amazing cases. And even if there is a diagnostic, then for 90% of the cases, there are no treatment, and the drug company, working on disease with so few patients, they don't have a lot of motivation to do that. And again, if you don't know a lot about rare diseases, one of the first thing that was really surprised me, that if you think about rare, is it something that it's not common. Yeah, that makes sense. But if you look at the numbers, the statistics, that 10% of the individual level of the world population are suffering for one type of rare disease. There are actually 7,000 or actually more rare diseases, and that's why so many people get or infected or get rare diseases. So what we are trying to do, there are multiple challenges, and what we are trying to do with UNI Therapeutics is first develop fast diagnostic. So the idea is that after we get the sequencing data, is running an algorithm, running an analysis, and give the parents, the doctors, the genes that actually cause the disease. The second thing that we are doing is after we know the disease-causing gene, we build an entire network of genes that interact with it, drugs, and so on. And then we have really fast suggested treatment. And of course, what we are doing is cutting-edge technology. And few of the things that we recently published that show it's actually working. So in two very, very recent paper, we show that myocarditis disease that we all became familiar with during the COVID. So people that got vaccinated, some of them, very few, got this myocarditis, and we found the gene that associated with the disease, and we believe that it's really related and what make these people get sick. Another paper that we publish is that we show that very fast we can get for the unsolved cases, the cases when the kids, we don't know what causing their disease, we analyze their data and really fast get the disease-causing gene. And recently, well, 2 or 3 years ago, we published a paper showed that we can find drugs that affect MSCP2 mutation, which is a Rett syndrome. We develop an algorithm. The algorithm is called Evolutionary Signature Platform Technology. As you can see, because this is such a long name, it's definitely a very good and a promising algorithm. You have to understand that. And of course, what we are doing in this algorithm using more than 200 genome in the unique technology. I'm not going to talk about what you see here. All these different eyes is related to how the algorithm works. It's analyzed multiple genomes across many different species and use this information to understand which disease or which genes are actually cause the disease. The input is basically the disease, the gene causing, the gene that actually caused the disease. What we are doing here, we analyze many genomes, close to 2,000 genomes, based on their profile, their evolution, how it changed across evolution. We can identify its function. We find other genes that's related to that. We use lots of omics here to build the network. And then from the network, we find drugs that actually can affect the missing gene or the mutant genes or the network. And by that, we identify potential drug that we can use. The fact that we understand the mechanism of action or the other genes that actually work together, it can really help us to do multiple other things. We can uncover multiple or the disease mechanism of action, which is a key important for drug companies in many cases or for startup. We can identify novel drug targets because what we are doing, the minute we understand the mechanism of actions and how the drugs is working, we can identify other potential targets that we can use to get the same effects. We can expand drug use for additional diseases. What you see, if you know biology, of course, is that all the genes or many of the genes or the protein are highly connected. And if you affect one drug, in many cases, you get response to other drug, and we use it for our advantage. We use the complexity of biology for our advantage. We, of course, because we know the mechanism of action, we can in many cases predict side effects. And the analysis that we are doing, and we find the genes or the proteins that related to the disease, that associate or that connect the genotype to phenotype, we can generate our analysis and find other or combine it with other sources. The thing the drug company is doing and startups are doing that. And because we understand the network, we can also suggest drug combinations. There are multiple people in our team. Oren Gez, who is a founder with me, and we have Gili Hart and Mark Cohen, who are a board member. And I think why it's all related. And you know what we did with the Rafa stories, and I will give you to the last minute or half of the minute, is that we took the disease-causing genes, we generate the network, understand the mechanisms of action, and pretty quickly we were able to identify multiple drugs that can affect, or at least predicted to affect, and maybe rescue the symptoms of the disease. We tried. Some of them seems to work in nematodes, and you know, we are optimistic. And for the final word, if you want.
No, I didn't plan, but yeah. Going forward, we're going to fund promising researchers and biotech companies looking for the most exciting and promising technologies. It's a mission. It's changing like your life course, getting the diagnosis. And we hope to do good with the research fund for S6BP1, Raphael, and many other kids that has or suffering from rare diseases. Thank you very much.
Thank you so much, guys. Let's stay up for just another minute here. I really like the way these guys operate. It's much like they do in the American Senate. It's that they reserve their time and they pass it over to the next person. It's very professional. I liked it, effective. So really great work. Tell me something. I realized that your solution, as you had in the middle of one of your graphs there, was big data, right? It's based on data sets, data points. So I have a twofold question. Yours might be the second half, I suggest, right? So the first half is, how far are you away from having enough data to make the solution effective? Is that you've got it now? Is it in a year? Is it 5 years? Is it 10 years? Is that a not a valid question? Because I see you looking.
No, it is.
Right?
So,
and the second question will be, what are you looking for at this stage? What can you, so you need partners? Are you looking for more money? What is it? So from a business point of view, what are you looking for commercially?
Okay, so currently there's a huge amount of data. Actually, the graphs of the amount of data or the data in biology is duplicate itself every year or so. So we have every year the double amount of data. So I think that we can now very quickly, and we show it in our papers, we can find the disease-causing gene and find potential drug. Of course, these are hypotheses, and we need to test them. So in terms of the data, we have enough, and it's working fantastically.
And I believe there'll be a time in the future where it will be so instantaneous because you have results and data that's already produced these solutions before. It's going to get more efficient as time goes on, right? Yes. I knew that was coming. All right. So from a business point of view, what is it you're looking for? What's going to help you to get to the next stage?
For my fund, so
yeah.
They commercial company
to ensure Uni's going to get to the next stage.
They need money, investment, securing funds. For the great technology, for us, it's a new venture, philanthropic, so it's donations to keep going the activity. We're going to fund grants in this year. We're going to be like around $1 million that we already got, and we're going to keep the operation going.
Excellent, guys. Well, looking forward to see the solutions that you come in. Please give a massive round of applause for UNI Therapeutics.